Thanks to everyone. Great day, and I thought there were some really great ideas that came up in that recent session, and so many really good things. I think a lot of people are already doing a lot of those things, and I've been inspired to do more of them. I think one way to get something done is for people to do some of those things, and then if they're successful in reaching some folks in rural areas or some folks that haven't had access, to then publicize that so that we can take what works and then export it and have it be done in more places. And so I think there's a terrific role for that. So I want to thank people. That's part of what we want to do. So thanks again to our sponsors. We extend our heartfelt thanks to the generous donors and sponsors who have made this gathering possible. I want to very specifically thank the Maurer family, whose gift is given in loving memory of Riker Mulholland. I also want to thank the Stetler family for their amazing work, and to our corporate sponsors, Young Living, Cozy Earth, the Grand America Hotel, and the Larkin Mortuary. To all our sponsors, we are deeply grateful. I just want to reflect on, how proud I am about this conference and the work that you all are doing. And I apologize for not being here earlier. I was taking care of patients, and it's been a little bit of a juggling act. But I saw a couple of patients today who just really reinforced to me just how valuable all the work that you're all doing is. And I saw someone who literally had 8 pregnancy losses, a couple of second trimester stillbirths, most dramatically a neonatal death where she had a classical cesarean and then had her baby survive for a while, and just recently had a live birth. And we did some medical stuff, but most of her journey was really the emotional support that she had from a lot of our peer-to-peer folks and from the community, giving her hope and allowing her to kind of get through this. And then later I saw another patient who was 6 weeks out from delivering a pre-viable infant who suffered a neonatal death. And that was the sad part of this. But she was so grateful for the experience that she had because she felt so supported by our nurses and our clinicians, and also by peer-to-peer support. And because of people like you, she had a bunch of mementos of her baby. And they just kept talking about how happy and grateful that they were that they had these mementos, and they've shared these mementos with their family. And they were thinking about, maybe we ought to just kind of go to sleep and have a D&E, and they didn't want to get near, actually going through the birth process. But they couldn't have been more grateful, and they were just so thankful for the emotional support. So I get to see the day-to-day positive impacts of the stuff that everybody here is doing. You may not see it day-to-day, but I promise you it's going on. So please keep doing what you're doing, and thank you for doing what you're doing. So now we are going to present our second annual Stillbirth Champion Award. Last year the award went to Debbie Haynes with her dedication to stillbirth prevention research and to federal advocacy and getting the Shine for Autumn Act passed. It looks like it may actually even get funded this year. Deb is a tough act to follow. But this year's Stillbirth Champion Award is going to Dr. Lupe Aguilera. So let's hear it for Lupe. Lupe, we're going to embarrass you a little bit here. So Lupe holds a PhD in sociology from the University of Utah and is a social demographer by trade with postdoc training at the University of Wisconsin-Madison, and just as of this week has an appointment as adjunct faculty here in our Center of Excellence. Her research interests include refugees in stillbirth and family well-being after stillbirth. Lupe is special because she makes us think about wider groups of people affected by stillbirth, Her personal experience of being not only the aunt of a stillborn baby, but also the sister of a stillborn baby has driven her passion for her research focus on the impact of stillbirth on entire families rather than just the parents. This really makes us think about the burden of stillbirth in a much bigger way. It's not just babies who die and their parents, but siblings, aunts, and uncles who are affected. Don't forget grandparents. Lupe has enthusiastically and wholeheartedly engaged with the stillbirth advocacy and research communities over the past several years, taking on roles in the U.S. Stillbirth Advocacy Working Group, advocating for stillbirth education at the Mexican Consulate, and community groups promoting advocacy and education for Hispanic and Latinx families. So congratulations to Lupe. So,
you know what, just a second, sorry, Lupe? Do you want to come and say something? Come, I know I'm putting you on the spot. Totally on the spot.
No, I don't know, just thank you so much. It's been, it's such a welcoming community, and I loved being part of SOG and working with everybody and kind of stepping into working in this area. There's, you know, my family history of this happening, and it's been a journey, I guess, of professionally stepping into this area, having known like personally what the impacts are, and thank you so much. Okay.
So I'm going to screw up this next part, even though Dan's trying to help me not. But I want to thank everyone who made this day happen, because it's a ton of work. So thanks to the team: Leanne, Lejeune, Sue, Stacy, Sarah, Ashley, Inez, Danae, Ann, Des, and Zan. Let's hear it for Zan. If Zan wasn't a crazy Energizer bunny, none of this stuff would happen. So, I also want to mention that, believe it or not, this is our off year where we're not really having a conference. But next year we will have a more official conference. So we'll have some international partners. We hope to do Improve Again and the US PAL Network Learning Day. So thanks again.